Welcome back, it's Dr. Somji. After I posted a video many years ago talking about the top treatments for non-surgical skin tightening, I always get messages about different devices. So today we're going to be talking about the top treatments that you guys have asked that help with facial tightening. I'm going to rank them and I'm going to tell you when they should be good to use, and also maybe they might not be good as well. So let's go through them. So the number one that was requested was Morpheus8. This is a treatment that I was the first to perform in the UK in 2019, and then it became super popular afterwards in recent years. It's essentially a radiofrequency microneedling device, which doesn't mean that you're doing microneedling. The little needles that are sitting in the skin are delivering energy at set depths. So with the Morpheus8, particularly for the face, you can use depths between 1 millimeter up to 4 millimeters. You can go deeper with certain handpieces, but you probably wouldn't be. Look, I've been doing Morpheus8 for a really long time, and some people say, is it good, is it bad? Well, I always say it's about who's actually doing the treatment and who you are doing the treatment on, if that makes sense. Because sometimes some people are good candidates and some people are bad candidates. Is Morpheus8 going to give you a facelift-like result? No, it's not going to give you a facelift result because it isn't a facelift. A facelift is operating on that muscle layer, repositioning fat pads, as well as excising skin. With Morpheus8, all you are doing is stimulating the skin to produce collagen, and sometimes you're going in the fat layer as well. Now, here's where I always denote caution with Morpheus8. In my clinics, we only perform it at depths that releases energy within the skin. Mainly because I think that all of these treatments, particularly radiofrequency microneedling and Morpheus8, should be specific to the skin to generate collagen. If you're going deep into the fat, you could be damaging that fat layer. And if you damage that fat layer, you may be causing more aging to your patient. And this is a reason why in my practice, I no longer really use the Morpheus8 so much. I use more precise radiofrequency microneedling devices, such as the EndyMed device. Now, the reason why the EndyMed device is really good is that prior to any assessment, we assess the skin thickness. The skin thickness around the eye is not going to just be 1 millimeter for everyone. It might be 0.5 millimeters, it might be 0.6. The skin thickness around this area may be thicker than around the eyes. So therefore you have to tailor your treatment. And with treatments like the EndyMed FSR, you can be accurate to the nearest 0.1 of a millimeter. So you can deliver the energy where you need it most. And more power doesn't mean more results. You have to make sure that you look at the patient and you deliver a bespoke treatment. Then you can get good results from it. So Morpheus8, super popular. Everyone used to come for it. There was some issues with pain as well with Morpheus. It was quite painful with the way that it released the energy. But newer radiofrequency microneedling devices are coming out now, like the EndyMed Pro, who actually were the first to invent the actual technology, and they're more accurate. And like I said, as long as you go to a responsible practitioner, you might get a good result. The next treatment that people have been messaging me about is the Emface. Once again, I was one of the first in the UK to use the Emface. This is actually revolutionary because most non-surgical treatments don't affect the muscle layer within the face. Traditionally, the only thing that really affects the muscle layer is surgery, so an open facelift or even a small SMAS lift. Now, when we're looking at the Emface, it uses two technologies. One technology that's stimulating the lifting muscles of the face, particularly in this mid-face, so the zygomaticus major and minor muscle, and it will just help with that resting tone. So you may have seen me on TV doing like facial yoga exercises that help lift the face and firm the skin. This almost supercharges that result. But remember, it does not stimulate that lower SMAS. It stimulates those lifting muscles within the face that are superficial muscles, but it won't stimulate the SMAS like they say it does. There is a limit to that treatment, but I still like it because it's particularly useful for patients that want to maybe lift the brow and improve the resting muscle tone of the frontalis muscle to have a better brow position. It's good for patients that don't necessarily want filler to add a little bit of volume through increase in muscle bulk. So it's actually a really nice treatment that really, before you think about injectables, or if you don't want injectable treatments, maybe you should entertain the Emface. It's got some good results. Also, it releases radiofrequency energy, which is great for the skin to improve collagen production as well. So it gives you an all-round effect. At the moment, it's really only approved for the face. There's not much going on in the neck. It may help with the jawline a little bit, but I think with future advances within technology, you may see a little bit more going on. But definitely it's something that's quite exciting, and actually a lot of patients really like it in my clinics. The next device is the Sofwave device. This is a device that's FDA approved for fine lines and wrinkles. It's approved for facial lifting, neck lifting, and also recently it's been approved for brow lifting as well as cellulite reduction in the body. So it's a device that is essentially not using new technology. This is essentially focused ultrasound that creates selective damage at 1.5 millimeters underneath the skin. Sofwave is fantastic because it's a safer version of something called ultherapy. We all used to use ultherapy in a clinic, and ultherapy is release of ultrasound perpendicular to the skin. The problem with that, and the problem with actually topical radiofrequency devices, is that you're getting spread of energy into deeper layers where you don't want it. So the makers of Sofwave were like, we've got loads of these ultherapy patients that suddenly were losing fat in their faces later on and looking more aged, which maybe, if you let me know in the comments below, has happened to you before. They said, well, look, there are some patients where the energy has worked and it's created collagen and his face looks great. But in some patients, it's spreading deeper. So how can we release the energy in a more accurate way? With Sofwave, they release the energy as parallel beam technology, which means that their energy is released parallel to the skin, so it doesn't go down deeper. And that way it's been a lot safer. So Sofwave, again, it's not the most pain-free treatment, but it is very effective. And if you're worried about fat loss with energy-based devices, then Sofwave is going to be your one. That is very good because it will only release the energy in the skin where you need it most. And that, I think, is the new trend. I've said it here first. We don't need to be going aggressive with energy-based devices in clinic. If we just say we want to stimulate the skin, that's more than enough, and that's what you need to do. If you want deeper lift and tightening, then really you need to wait when you're a right candidate for maybe something a bit more surgical. And there's no harm in doing surgery at the right time, at the right point in your life. The next treatment I'm always asked about is thread lifts. Do they actually lift? Well, look, take it from me. I think that thread lifts are just placement of almost lines of collagen underneath the skin. I don't think that you can reposition a fat pad permanently with thread lifts. There are some permanent lifts that you can use that do give you a little bit more lift and repositioning of the fat pad, but it's a very mild repositioning and it doesn't tend to be permanent either. When you're introducing thread lifts, they tend to be made of something called poly-L-lactic acid, which is what Sculptra is made of. And Sculptra is approved for generation of neocollagenesis, so new collagen. So when you're putting the threads in, you're almost putting like lines of collagen in this way as a lattice. So you may help with stimulation of the skin, you may get a little bit of firmness, but you won't get a lift like that. You'll get an immediate lift, but it will always come down. And that's really important. So when they say it's a thread lift, I think they should rename it to just like collagen boosting threads, etc. And I think that's what you get with thread lifts. So you don't get a mini facelift. If someone says to you, this is gonna lift your face, I don't think so. I think it's gonna give you a very small change in terms of lift, but you will get an improvement in skin quality, you'll get an improvement within the firmness of the skin. And I think that's the benefit that you get with a thread lift. If you think anything different, let me know. But I mean, I've done thousands of these and I can see the results on my patients. I think it's a useful adjunct within clinic, particularly within a non-surgical setting. But can it replace surgery? Nah, definitely not. So there we are. Those are the top non-surgical treatments that you asked me about. I've reviewed them. I've told you which ones are good, which ones I use within clinics, and also circumstances where I wouldn't do it. And hopefully that's helped you. Let me know in the comments below. Don't forget to click the link to subscribe as well as the bell button to make sure that you stay tuned with all the new videos that come out.